Have you ever received an urgent call claiming your routine health screening revealed early-stage cancer requiring immediate treatment? Agnes Murphy, a 76-year-old retired nurse from Boston, Massachusetts, who had survived breast cancer 5 years earlier, thought she was catching a new cancer early when oncology specialists called about suspicious findings in her recent screening tests. Within 1 week, she had paid $20,000 for fake cancer treatment that put her health at serious risk. Agnes's story reveals how medical scammers target cancer survivors and health-conscious seniors, using their fear of cancer recurrence as the ultimate manipulation weapon. By the end of this video, you'll understand exactly how these fake cancer specialists operate and learn the warning signs that could protect cancer-conscious seniors and their families. Stay until the end because Agnes's experience shows how fake cancer treatments can endanger patients while stealing money, making these scams among the most ruthless healthcare frauds targeting vulnerable seniors. The Cancer Fear Call. It was a Monday morning in August when Agnes's phone rang with a call that would exploit her deepest health anxiety. She had just returned from her routine mammogram when her caller ID showed what appeared to be an oncology center number. Mrs. Murphy? This is Dr. Sarah Williams from Advanced Cancer Detection Institute. I'm calling about urgent findings from your recent comprehensive cancer screening that shows suspicious cellular activity requiring immediate oncological intervention. Agnes felt her heart stop. As a breast cancer survivor, the word suspicious triggered immediate panic. Dr. Williams continued with practiced medical authority that seemed both knowledgeable and terrifying. Mrs. Murphy, your blood work shows elevated tumor markers, and imaging reveals concerning nodules that indicate possible metastatic activity. Given your cancer history, this requires emergency evaluation and treatment. The caller knew Agnes's cancer history, her nursing background, and even referenced her recent medical appointments. This personal medical knowledge made the emergency seem credible and absolutely terrifying. I need to stress how critical early intervention is for cancer survivors. Recurrence patterns in patients with your history can progress rapidly, but we've caught this at a stage where aggressive treatment can be completely curative. Building cancer terror. Dr. Williams continued using sophisticated oncology terminology that Agnes recognized from her nursing background, making the claims seem both legitimate and urgent. She described cancer progression and treatment protocols with medical fluency. Your specific tumor marker elevation pattern shows classic signs of adenocarcinoma recurrence with possible lymphatic involvement. The imaging findings suggest we're dealing with early-stage metastatic disease that requires immediate chemotherapy intervention. She explained that Agnes's medical background meant she understood how quickly cancer could progress. Agnes had indeed been vigilant about follow-up care and lived with constant fear of recurrence. As a nurse, you know that cancer doesn't wait. The cellular activity we're seeing typically doubles every 2 to 3 weeks in survivors. Patients who delay treatment beyond 1 week often face significantly worse outcomes. Dr. Williams created urgency by explaining that Agnes's nursing knowledge made her an ideal candidate for aggressive early intervention, and that immediate treatment could prevent the devastating progression that killed other cancer patients. We need to begin emergency chemotherapy protocol within 48 hours. This specialized treatment costs $20,000, but it's the only intervention that can stop the cancer progression we're detecting. The Treatment Urgency Protocol. Dr. Williams explained that Agnes needed immediate chemotherapy to prevent cancer spread. The specialized protocol would be customized for her specific cancer markers and history. Emergency cancer treatment requires immediate payment because we need to compound personalized chemotherapy drugs for your exact tumor profile. Standard insurance processing would delay treatment beyond the critical intervention window. She provided Agnes with specific oncology codes and cancer treatment authorization numbers that sounded official. Dr. Williams seemed to have detailed knowledge of cancer protocols and spoke with authority about emergency oncology procedures. I Understand this is frightening and expensive, but what price do you put on preventing cancer death? This treatment protocol has a 98% success rate when administered within the critical 48-hour window. Dr. Williams created additional pressure by explaining that emergency oncology scheduling was extremely limited, and Agnes needed to secure treatment before other cancer patients filled the available slots. Based on your tumor marker levels, we've cleared emergency treatment space specifically for your case. Cancer doesn't wait for convenient timing, and neither can we. The payment desperation. Agnes felt overwhelmed by cancer recurrence terror and the pressure to begin life-saving treatment immediately. Dr. Williams had created such convincing medical urgency that questioning the treatment seemed like accepting cancer death. She agreed to the emergency chemotherapy. Dr. Williams guided her through the payment process, explaining that the cancer treatment facility required wire transfer to secure her emergency treatment slot. Emergency cancer protocols require immediate wire transfer to guarantee chemotherapy drug compounding and treatment room availability. This is standard procedure for life-threatening cancer intervention when timing is critical. At the wire transfer location, Agnes hesitated when asked about the payment purpose. Dr. Williams, still on the phone, coached her to explain it was for emergency cancer treatment, which sounded medically urgent. Agnes sent $20,000, believing she was saving her life from cancer recurrence. Dr. Williams assured her that treatment would begin the next morning and provided pre-chemotherapy instructions. You've made a life-saving decision. This chemotherapy will eliminate the cancer cells before they can establish metastatic disease. The dangerous treatment. The address Dr. Williams provided led Agnes to a converted warehouse space that looked medical, but lacked proper oncology equipment and sterile treatment environments required for chemotherapy administration. The people claiming to be oncologists were not qualified cancer specialists. They had Agnes sit in a chair while they administered intravenous fluids that they claimed were personalized chemotherapy drugs. The fake chemotherapy involved unknown substances that caused immediate nausea, weakness, and severe fatigue. When Agnes expressed concern about the intense side effects, the fake oncologists assured her this meant the treatment was working. These symptoms show the chemotherapy is attacking cancer cells aggressively. Cancer treatment is difficult, but patients who tolerate the initial protocol have the best outcomes. After 6 hours of fake chemotherapy, Agnes felt sicker than she had ever felt during her real cancer treatment. Her blood pressure dropped, and she was experiencing concerning neurological symptoms. The medical emergency. Agnes's condition deteriorated rapidly over the next 12 hours. She was vomiting continuously, had severe weakness, and was showing signs of possible poisoning from the unknown substances. Her daughter insisted on taking her to the emergency room. The emergency physician was immediately alarmed by Agnes's symptoms and the story of unauthorized chemotherapy administration. "Mrs. Murphy, you've been given dangerous substances that are causing toxic reactions. Whatever treatment you received was not legitimate chemotherapy, and you need immediate medical intervention to counteract these effects." The emergency team had to administer IV fluids, anti-nausea medications, and monitoring to stabilize Agnes from the poisoning effects of the fake chemotherapy substances. There are no elevated tumor markers in your blood work. Your cancer screening results were completely normal. You've been the victim of a sophisticated medical scam that has seriously endangered your health. The Medical Truth Comprehensive Oncology evaluation revealed that Agnes had no signs of cancer recurrence whatsoever. Her recent screening tests had been completely normal, and there were no suspicious findings requiring any treatment. The fake chemotherapy had caused chemical poisoning that required several days of hospitalization to fully resolve. Agnes's kidneys and liver had been stressed by the unknown toxic substances. Agnes's real oncologist was horrified that criminals had exploited her cancer history to administer dangerous chemicals while claiming to provide life-saving treatment. "This is the most cruel scam I've encountered." They used your legitimate cancer fears to poison you while stealing your money. Your cancer status remains excellent with no signs of recurrence. The investigation medical fraud investigators explained that Agnes had been targeted by a sophisticated operation that specifically focused on cancer survivors and health-anxious seniors using their recurrence fears as manipulation tools. The investigation revealed that the same group had scammed dozens of cancer survivors using similar fake emergency treatment scenarios. They had stolen over $1.2 million while potentially causing serious health damage through toxic fake treatments. Police discovered that the scammers used detailed cancer survivor databases, fake oncology credentials, and dangerous chemical substances designed to mimic chemotherapy side effects while creating believable treatment scenarios. Warning signs. Agnes missed. Looking back, Agnes identified several red flags she wished she had recognized. Unsolicited calls about emergency cancer findings. Legitimate oncologists never call patients about cancer emergencies without scheduled appointments or established doctor-patient relationships. Immediate treatment demands with same-day payment requirements. Real cancer treatment is coordinated through established medical facilities with proper pre-treatment evaluation and insurance verification. Pressure to begin chemotherapy without second opinions. Legitimate cancer specialists encourage patients to seek additional consultation for major treatment decisions, especially emergency protocols. Wire transfer requirements for medical treatment. Established cancer centers process payments through normal medical billing and never require wire transfers for emergency treatments. The recovery journey. While Agnes never recovered her $20,000, her health gradually returned to normal after the toxic effects of the fake chemotherapy subsided. Her real cancer status remained excellent with continued clear screening results. Agnes's experience led to increased awareness about cancer scams targeting survivors in her community. She began working with cancer support organizations to educate others about medical fraud. Most importantly, Agnes learned to verify all unexpected medical communications through her established oncology team before taking any action regarding cancer concerns. Final thoughts. Agnes's story demonstrates that cancer scams are uniquely cruel because they exploit survivors' deepest fears, while potentially causing real health damage. These criminals understand that cancer survivors will do anything to prevent recurrence, including paying large sums for emergency treatments. The key lesson from Agnes's experience is this: legitimate cancer emergencies are never resolved through unsolicited phone calls demanding immediate payment. Real cancer treatment is coordinated through established oncology channels with proper evaluation. If you receive calls about cancer findings or emergency treatment, hang up and contact your established oncology team immediately. Never agree to cancer treatment based solely on phone calls, regardless of how medically urgent they sound. Remember, protecting your health means working with qualified oncologists through established medical channels, not paying scammers who exploit cancer. Fears to administer dangerous fake treatments. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivations and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating good content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.